Hey guys, if you can in fact hear me, would you go ahead and message me? We were having some problems with software. I just want to make sure that you can in fact hear what I'm saying. For some reason, YouTube was like being weird, like not letting me in. So for today, I kind of changed how we do things. This time, I want you to be able to text or call me live. In fact, I got to get my Bluetooth before I forget. I was up managing and juggling so much software. It was hard to get everything set up because we had to be able to stream to YouTube so you could catch the broadcast. But I want you to be able to text or call me at 905-2298. And the zip code, or not the zip code, the area code is 512. So 512-905-2298. And hey, how's it going? Okay, just go to my YouTube channel. This one's out in the public because the first 2 hours is free to everybody. So you should be able to just find it on my YouTube channel. You can go ahead and come lay down on your side. Doesn't matter which. Gardner Wellness. Yep, Robert Gardner Wellness. Thank you. If you need anything else, feel free to call me. Okay. So guys, I got a bunch of new stuff set up. I don't want you to feel like you can't call me. I don't want you to feel like you're bothering me or anything like that. I'm still learning how to make all of this work like as best I can to be able to teach you guys as interactively as possible. And we've essentially got 4 to 5 muscles that we're going to go over today. But I want to talk real briefly as people are still coming online about what we do for like intake. So you normally have to deal with paperwork, you got to deal with, soap notes, that sort of thing. What I'm going to do in a very quick way is just demonstrate how I deal with intake from a verbal construct. Normally, I would be making eye contact with Chris here. You go by Chris, right?
Yes.
Yeah. So I would be making eye contact and I would just ask her as a client, like, what are you having problems with? Or what do you normally have problems with? I mean, literally, like
my knees.
Knees? What's up with your knees?
I have no idea. Either from slipping from or from Metallica.
Okay.
I'm assuming it's somewhere in my legs.
So did you go to a Metallica concert?
Like
that's you're probably not the only Metallica fan who almost died at a concert.
It was pretty brutal. But I'm assuming I also work out every day, 2 to 3 hours. So I'm assuming it's coming actually somewhere from my legs. I don't think it's coming actually from my.
Okay. So I'm going to take that into factor, okay? The reason I wanted to bring that up is 9 times out of 10 when I work with people, they're going to have upper back and neck pain. Like what percentage of your clients do you think come in with that?
100.
Yeah, it's like
everyone.
60% plus probably. And the rest is like low back. Occasionally I'll get something like knees.
When they tell me something else, I'm like, oh, okay.
So normally what I would do, and this is why I want to bring it up for the intake, normally what I would wind up doing is I would work probably on her knees first. Because she's saying she has a problem with her knees. I would want to address what's going on with her knees. I want to communicate with her about her knees. I want to build like rapport. If she says, I have problems with my knees, and I do what I'm about to do, which is like, okay, how you doing up here? Do you feel like I listened to you?
No.
And that's the problem with therapists working with clients, where the clients aren't getting their needs met because they don't feel like the therapist is really listening to them about what they're having problems with. So I'm probably going to take a look at the knees, but I'm actually going to kind of start backwards. Normally, again, if I was doing a full session, I would definitely probably work on her knees first and try to focus on that because I'm a problem-oriented therapist who provides a solution. Like if I can help you with your knees, it's much more likely that you're going to come back to me, build a rapport that I know what I'm doing when you have just back pain or whatever else. So the thing is, I put her on her side. She's completely clothed. If I was having a client in, typically what I would do is I'd say, listen, she'd be sitting in the chair and I'd say, take off your shoes, lay down on the table just like you are. From there, what would happen is she'd go, huh? And I'd go, trust me, I'm going to move you around and see where we're going to work today. And usually that was enough to get them on board with what I was doing, that I worked maybe a little bit differently. So I'd say, hey, I'm gonna move you around so we can see what's up with your knees, see what's up with your upper back and neck. Do you ever have problems up here?
Yes.
Where at?
There.
in there? Just
Yeah.
normally this junction
Every
here
once in a while, I'll get it up like
at the
middle.
base.
Yeah.
Okay. So sort of cervicothoracic junction. I just wanted to talk about that intake briefly because you're going to deal with that with clients, I think, repeatedly. Did I lose something? I don't know, it's stuck in my ear. There we go. Part of my Bluetooth is falling apart. So once I've got her on the table, the next thing is when I look at her, like the size of the bolsters can be completely different person to person. What I'm seeing is her head is elevated because of the size of or width of her shoulders. So I need to be able to create a different pillow that's a different size because I want her head to be at neutral or maybe a little bit lower. Lay your head down from there. That looks more neutral to me. If she has her head lifted, it's creating some curvature in the neck. That's not something I want if I'm eventually going to come in and put some pressure back here at all. So what I'm going to start to do is this 9 times out of 10 is what sessions on a table with me would look like. Now, I had to borrow a table because my practice is nearly completely mat-based. And let me say that again. My practice is nearly completely mat-based. I don't even own a massage table at this point because the people I'm working with know that I work on a mat. They know that the sessions are 3 hours long, but I had to transition people, and people keep thanking me for still teaching table classes. The thing about teaching on the table is I'm probably never going to stop because I have to meet the therapist where they're at, and we're in a table-based industry. So, to make her comfortable, take off your shoes, lay it in on the table, just like you are. Let me check a text message. Hey Jen, thank you for messaging me. Let me know you can hear everything. So here's the deal. What I'm then going to do is say, listen, you have more problems up here. Is that typically where your upper back and neck hurt you?
Yes.
Okay. And then you said sometimes it kind of goes to the base of your skull?
Yep.
That little light physical contact actually makes a big difference for people because what she gets to see is that I'm, paying attention to the area she's having a problem with, right? So let me adjust my equipment here. What I'm going to do is I'm going to bring her arm up and then I'm going to gently roll her open. If you're watching us at home, what I want you to do is I want you to put one person on the table. They're going to give for about an hour, and then we're going to switch and you're going to receive for about an hour. I'm just checking out her arm here. I can feel some stuff in her forearm extensors. Like I'm just naturally doing what I do, which is using movement, trying to figure out what's going on. How does that feel? Good, okay. And if I traction you down, how's this? Good, okay. Do you feel that kind of in that area? Yeah. Okay.
I didn't until you touched it.
Yeah. So, and here's the deal. When I asked her, do you feel it in that area? In other words, for a lot of clients, if I don't touch where they have a problem, there's going to be an issue. She says, I have knee problems, and I'm like, okay, let me work on your upper back and neck. And you're like, this guy's a loser. I don't ever want to come here again, right? Yeah. But if you have an issue with your knees and I start working with the knees immediately, you feel like I've listened to you. Yeah. So what I did was I formed a little connection via touch to say, hey, it's right here. And then I immediately went to work on it by using mobilization and traction. Now, I'm also just getting a feel here. I'm going to see if I can switch cameras again. Into the back. Nope, wrong one. I'm upside down. There we go. Right back here. So rhomboids and then paraspinal muscles, right?
Yes.
Okay. So right in there. So when people have pain in the back, I don't want to come in and let's say the way I work, it seems kind of backwards sometimes. I'll tell you that flat out, okay? So what I'm trying to do for a lot of people when they have upper back and neck problems, and we'll talk about this at length, I think people are slouched forward into a kyphosis. They're rolled forward. So what I do is take them and roll them back and opening their pec minor. The problem is, me as a male therapist working on a female client, then I'm in an instance where even though I know pec and major and minor might be an issue, how do women feel if I come and just directly start working on pec?
Even I, as a female therapist, I still warn people.
Yeah.
Because just because I'm a female, it doesn't mean that they're comfortable with anyone being in that general area.
And as a male therapist, I have to put even a little more concern towards that, I think. But what the first thing I did was like roll you open. It's lengthening pec major and pec minor. I'm able to traction and I say, hey, do you feel that in the area?
Yes.
Because if she said no, then I might have to move to another tool. But as soon as she feels that, I'm like, listen, if I pull down, is that preferable to pulling back? Down is better. Okay, so I'm going to put her on her side. And here's what I'm going to do. One, you guys don't have to worry about your microphone, but I do. I'm going to come in, I'm going to slide off one of my shoes, and I wear shoes purposefully that like are not laced so that I can do this. I used to wear like dress shoes or stuff I could get away with at the chiropractor's office. I'm going to come and sit, and I'm going to sit right next to her. So what are you taught about passive body contact in school? Don't do it. I think they're wrong. So here we go. Now, I'm going to have to judge position. I'm going to scoot back a little bit further. I'm just about at her sacrum. So as I'm pulling on her, she knows that she's not going to fall off of the table. Okay? I'm right here. And I'm getting a handle on her shoulder blade so I can move her around. I'm going to move my hand. How's this right back here? Feels good?
Yes.
Okay. How does it feel when your shoulder blade rolls on my fingers? Pretty good? Yeah. Okay.
But I guess it's a normal technique that people use.
Yeah. So when I roll you over my fingers right there, still good?
Yes.
Okay. So what I'm doing here, and I'm going to show you two different versions of this, okay, is I'm trying to get a grip on her. I've got my fingers just under her shoulder blade. Not everybody will be able to do this. I'll show you another version in just a second. I'm going to grab this and pull her back and open. How's that? Now, she knows she's not going to fall off of the table. She is petite enough that I can quite literally, go ahead and reach in and be able to put pressure right into this area. When I lifted you back up and over, do you still feel it up here?
Yes.
Yes. And that's the difference. Sometimes I kind of touch the area to let them know I'm working on it. And then at the same time, I'm actually in a position where I'm using mobilization to try to access something deep down towards her spine. So when I come in, I'm right at her sacrum. I'm right here. I can also grab just at the top on the shoulder here. And when I do this, I'm going to lean back just a little bit and down. Now you can see that her head lifts completely off of our pillow there. How's that feel? Okay. Do you still prefer when I roll you to the back? Yeah. So she tells me, oh yeah, that's good. So in her case, because I can grab here, I'm really going to give her a more robust pull this time. We did a couple almost like as a tester. How's that? Yeah. Now, you like where my leg is pressing.
Yes.
Why does it feel good? Yeah.
Because it's an extra point of contact, but it's also because it's a firmer tool.
Yeah.
It's also pushing up, on my erectors.
Yeah. So when she's being pulled over, she's petite enough that I'm essentially lifting her. That's what she's making reference to. And then I want to bring a little bit of a specificity to what we're talking about and what we're actually lengthening, okay? So when I'm working, we're dealing with the traps, particularly the upper traps. If you look on the side with the springs and coils, we're essentially mimicking that motion. So when I'm pulling her arm down, that's what she's feeling. When I'm grabbing around her shoulder blade and pulling her down, that's what she's feeling as we go through that. So when I'm here and I'm pulling down, she's feeling the length on trapezius there. Now, the difference with this is like if I'm just freestanding, are you a little more afraid I'm going to pull you off the table?
Yes.
Exactly. So there are two things. One, we provide more physical contact, not less. She's completely clothed. I'm completely clothed. She feels comfortable. This looks somewhere in between like a stretch service and massage. is how the people receive it, right?
Yes.
So when I come in and now I block, because my arm and leg is here, now what's going to happen is I'm going to lean and pull her back again. Lean and pull her back and open. Lean and pull her, and you still like to the back.
Yes.
So for this, I don't have as good a grip here. There are going to be some clients that you work with that this is going to be the grip. This is the one you want to use, and I think that's completely fine. It really depends on you. I like this with her where I can grab onto the shoulder blade because I can literally just lift and pull her up. How's that? So stoic. Good, thank you. Oh, right. Oh, there. Oh. Now, at any point, does that feel uncomfortable?
No.
No. Does it feel like it's lengthening some of the stuff you came in with for up here at least?
Yes.
Yeah. So the next piece is, we talked about the upper traps. I want to talk about levator scapula, which when I'm grabbing onto the shoulder blade and we lean back and we lean over, it is lengthening all the way up into her neck, okay? When I grab the shoulder blade and pull her back, down, over, holding the shoulder blade, it's accessing levator scapula. We're essentially working on her neck by tricking her to let go. I haven't pressed on the neck other than to like press into the suboccipitals. What we're doing is we're going in and putting a little length to that area by leaning back and over, and you can see it lifting her head and neck. Working levator scapula up into those insertions. I think that that goes a really long way to helping people with the stuff that they have issues with in their upper back and neck. So that was one, this is the first time I've worked with Chris, so you can give me feedback. Like, how does that feel right now?
Good. Like I can feel it, like when you're doing it, like I can feel it like in my skull, like I can feel it.
Yeah. And that reference pain is probably, I'm assuming, from levator scap. I'd have to look and see. Sometimes people will have issues like splenius capitis and some other muscles that will refer up to that
It's just
area.
a muscle chain that's also lengthening,
Sure.
stretching out that people probably wouldn't feel.
Yeah.
And I mean, I know, like personally, like for me, that much feedback when I've stretched people or on their neck that they felt it up there. So I feel like this more than their traditional pad would.
Do you normally have more problems with your right side than your left?
No, I feel it.
Left side normally. Okay. So what I'm going to do here is I'm going to go ahead and repeat the same thing on the opposite side. Can you just flip sides for me?
Yes.
And then she's going to, usually they'll bring their bolster with them. And what I like to do if I can, and you don't have to do this, just make sure they're comfortable, is I like to have the upper leg bent and the lower leg out. I prefer that, but it really just depends on the person I'm working with and like what they prefer as well. I want them to feel comfortable, and mostly their spine is at neutral. So I'm going to come around to the other side, same thing as before. Make sure my phone is nearby. And do you normally have issues? You said it's not as bad on this side,
No.
but then if it does bother you, is it kind of the same area?
Yes.
Okay. And I want to go into her forearm extensors and really get into there and work on that. And how's that? Okay. Now, I've already introduced myself. I'm already working with her in a way that she is now at least more familiar with me than when we started. I'm going to slide off my right shoe this time so I can sit down. Again, for my body size, it looks like it works just about perfect to be at her sacrum so that my arms can comfortably reach here. I'm not really pulling with my arms, What I'm actually doing is more like leaning with body weight. So if I had somebody that was really super tall and I was very short, I might have to scoot higher. But wherever you're sitting, it's going to change the angle and leverage. So if I lean back, pretty good. I'm looking at her vibrometer there, checking out her face. I'm going to jostle her shoulder to get her to let it go. Give it to me. right in there. How you doing? Yes. Feels it up there. I'm gonna see if I can work around her shoulder blade just a little bit. So I think this passive body contact is like a huge component of what we do that actually makes the work really great, but that's just me. How's that? Like when I pick you up, move you around? Yeah. There we go. Really big pulls. Now, does it feel better when I roll you back and open or when I pull down?
I like that.
Back and open, okay. So I gave her a choice. I gave her two essentially directional pieces. I said I can pull straight down towards your tailbone, or I can pull back and open, like chest opening. And she chose the chest opening. So I'm gonna grab around the shoulder blade again and then pull. Back, over, open. Everybody's range of motion for this can be wildly, wildly disparate. But this is a way I'm going to soften up the area, introduce her to my touch, and I'm going to bring you down a little bit. How's that? Good. I've varied reasons for opening the session the way I just talked about. One of the things I really like is now I have worked on her. I have introduced myself. I have connected with her, and she's, clothes on. We're able to go ahead from this point and go, listen, do you want to go ahead, like let's say we just did 10 minutes, I'm gonna make up, I haven't looked at the phone. If we did 5 minutes on each side, what that means is I can say, listen, do you wanna go ahead and take off your top and bra so we can do deep tissue with you face down in the face rest, or do you wanna keep doing what we're doing? Okay, and here's what happened. Very rarely somebody would say, no, I kind of want the deep tissue or whatever it was they thought they came in for. Most of the clients said what she just said, which is, no, this is really good. Can we keep doing this? And I'd go, sure. And here's the thing. We save time because she didn't have to take off her clothes. We save money on laundry. We save money on oils and lubricants. It was like a win-win all the way around. And as a male therapist, it meant that I was able to develop connection and trust and intimacy with the client without having any other issues before like nudity was introduced. And I gave her the option because now I've moved her around to see where the problem is. I could very easily just go ahead and continue with what I think of as a normal massage, but she's actually like, no, this is pretty good. Like, let's keep working on this. Do you want to still just keep working up here a little bit?
Oh, yes, please.
Okay, so I can feel here around the rhomboids, around the paraspinals. One of my big postulates is, remember when we were talking about trapezius? I think that trapezius in many people is actually weak. The posterior chain is weak. It's the stuff in the front, the pec and pec minor, that's tight, that's shortened, that's pulling them into kyphosis. The other issue that a lot of people are having is when they're dealing with the rhomboids. I think the rhomboids, as much as we love like digging an elbow around their shoulder blades, I think that the issue is that's not really where the problem is coming from. The rhomboids are weak. The rhomboids are lengthened like the traps, that posterior chain, so that people are slouched forward, working on a computer, typing all day, right? So the issue is, as I'm working on people, I find it very easy to go ahead and work with them to do this, to be able to pull them back and open. So I'm starting to address the issue she's having problems with, which is in the pecs, which is in the pec minor, but I'm doing it by lengthening that area. Now what I'm going to wind up doing is we've done some lengthening and we've done some mobilization to try to mobilize into the area that was giving her some problem. Do you tend to like compression?
Yes.
Okay, so I'm going to go into primarily trapezius again. We'll show that. I'm going to go right up to that cervicothoracic junction so I can put a little pressure there. That junction, we all know it, between the neck and the upper back. And then I want to give her some pressure into levator scapula at that same cervicothoracic junction, the junction between the neck and the upper back. The way that I'm going to do that is I'm going to go ahead and come around. I have to move my pillow here, and I'm trying to see where I can position myself. So I'm at the head of the table. I want to be able to give a little length, pushing a shoulder down and away. How's that? Okay, lift your head for me just a little bit. I'm gonna move her pillow back just because as I'm moving her around. How's this right here? Is that too much?
No.
Okay, so I have a real uncanny knack. I went right into something with my thumb and she went, eh. So I'm gonna adjust where this is connected. Give me 1 second. And we're gonna go into a compression, that piece and portion. Let's see if I can get that connected. There we go. So right into here, correct?
Correct.
Okay. Is that too sharp?
No.
Not too, just ticklish.
Yes.
Okay. So everybody's going to be a bit different. I have to learn to communicate. If for you guys, like I'm juggling cameras and all this other stuff at the same time. So what I'm trying to do is I'm going to give her a little bit of length here. And she likes that. If I go in and press too quickly, it's almost like ticklish to her. So I'm trying to figure out like positioning to see. I have my table super low. I didn't talk about table height at the very beginning. I probably should have. I usually just set the table at the height I normally work. But for this, I actually dropped the table really low because of some of the stuff I'm showing, but we'll talk more about that in future classes. I'm gonna move my chair over and see if I can get close enough. So I can press, in my case, with the right hand, creating some length through those same areas. And then I'm going to bring my forearm in right there. How's that? Now, is that pressure too much? Mm-hmm. Okay. Do you prefer like pressure down?
There.
Okay.
I'm like, don't even give me another
No, and here's the thing. When I ask the client for feedback, it's not just making small talk. What I'm trying to get the client to do is to pull me into their nervous system right to the perfect spot. They want to be able to tell me, oh man, right there, that's it. Now I've got this spot. Now, if I roll a little bit forward or a little bit back, which of those do you prefer? Okay. If I go back, do you want me to keep going? No. Too much? Okay. Right there? There we go. Now, you can change. What I call this is usually compression with shear. Being able to do this is going to put you just at the right pressure using verbal communication with the client. It's also going to put you right in the perfect spot because she feels now, even though we maybe didn't cover this in the verbal part of the intake, she feels that I actually care about her and her discomfort and what she feels. Pulling her into the session, and I'm training the client. My regular clients will literally do this to me. If she had seen me, 100 times for 100 sessions, they will take my arm and go, give me your arm. And they'll just, right here, they'll put my arm in position for me. In other words, I don't have to search for it. They just tell me where it is because they've been trained in how to do this and they understand that I actually want their feedback. If I felt like that was too much on my left side, I'm going to switch it out. I'm going to go to the right side. So I'm going to see if I can lengthen now with the left hand and come in with the opposite forearm. How's that?
That's good.
Okay. So I'm gonna brace with this other hand here. Now, when I roll, do you still want me to roll to the back?
Oh yeah, right there.
Right there? Okay. Is that a little more down towards the feet? Or just right there?
Right there, please.
Okay. That one spot?
Yes, please.
There we go. Everybody's spot may be a little different. I've seen people leave comments on YouTube videos. I would hate if the therapist talked to me during a massage. And I think most of that has a tendency to deal with relaxation massage alone. Once I've built a rapport with her, I can be quiet for 3 hours. You asked me about this actually. Meditate, move, breathe, kind of undulate my spine, let go of tension. But a lot of the stuff I do for pain management, I think If I'm not quite on the right spot, it's not as effective for the client, and that's really my bread and butter, is dealing with pain management and mobility. Is that too much pressure?
No.
Feels good?
Yes, thank you.
Okay. You want a little bit more?
Yes, please.
There we go. So you can't really see that on camera. It was just me leaning in just a little bit more. This reinforced hand here, I'm going to see if I can, oh, how do I do that? Okay, I guess I got to hold on. Like, we're trying to figure it out here. We got to flip cameras. So as I'm right here, you're going to see through my arm, I'm actually just grabbing around my forearm here, maybe at the lower part of my wrist, so I can reinforce. Still the good spot?
Yes, please.
Okay. Now, if I go down.
Holy shit, yeah.
Okay.
Oh, sorry.
Holy shit, yeah. See, now what I'm going to do is put a curse counter on the video, and then it's going to cheer every time you curse.
Because you know it's going to be every 2 seconds.
So what we did was we just changed the angle, right? So if I give you a choice, like down or a little bit there. Right there. Yeah. So she chose, again, do you see the little bit of changes in like angle and focus? The reason I want you guys to give and receive each class you work with us is because of this. The therapist is going to tell you, oh, dude, right there, oh, that's it, that's it.
And then it's not a big change. It's not like you're like pushing, like it's very small, like, and I know that like when I watched, like I thought it was like a big change. It's really not.
Little change. So if I get tired, okay, so as I'm working, I'm using my deltoids, I'm using my arms, I'm using my rotator cuff, trying to reinforce where my arms are. And as I'm doing that, like you'll notice that I started with one arm, went to the second, and then I switched it. The reason I do that is to protect my own body. It also is going to allow me to develop a little bit of ambidexterity for my left and right side. So how does this feel so far?
Good.
Yeah. So let me do this real quick. You can do this following along if you want. Can you sit up for me? I just want you to move your head and neck around and tell me how it feels. Better. I will take better. And basically what was 30 minutes, right?
Yes.
Like now I'm talking. I could probably do that in a much shorter time frame if I was just doing the session and not teaching simultaneously, but generally just feels more open.
Yes.
Yeah, like less encumbered.
Yes.
Okay. And then what I'm going to have you do is just like you were previously, I think you were on your right side. Go ahead and lay on your right side. We're going to bolster her again. If you guys are following along at home, I'm going to try to repeat this twice. So if you don't like what I'm doing, you're in luck because I'm going to do it again. So from right here, we're going to talk about the gluteals, okay? So when we're dealing with the gluteals, one of the reasons I like to work the gluteals inside lying is because of gluteus medius, okay? Everybody knows gluteus maximus. Gluteus maximus is the big guy. The huge buttock muscle. Sir Mix-a-Lot is very familiar with this one. A lot of pulchritude run around on the internet, TikTok. But the gluteus max is just like the superficial layer, right? There's deeper muscles, including gluteus medius. And gluteus medius is a little bit more lateral. I like to work on gluteus medius inside lying. I feel like it's a little bit easier to reach along with some other muscles, including like the adductors, should you choose to work those. So when we have the person on their side, it's a wonderful position to put them in to work on this. So I'm going to quickly, I just grabbed a towel from my shelf. She's completely clothed. She's worked with me a little bit. She feels comfortable already. If this is the first time I've worked with her, I'm probably going to choose this option. Just a guess. I'm trying to think about therapists who are in various contexts. I'm going to cover her, and then I'm going to come in, and usually the greater trochanter is about right there. I'm going to come just posterior to the greater trochanter and start to do some compression around the gluteals. I'm also looking at her eyes because I'm trying to see if she, yeah. How's that? Good. Not too sharp? Yeah. Okay. A little more tender along the trochanter. So palm, very different than fingers, very different than forearm and elbow, right? But we talked about gluteus medius being a little more lateral. The problem with gluteus medius being more lateral is if she's prone or supine, it's like I have to come in from the side. Because she's now on her side, I'm able to just sink straight down and allow some compressive force into gluteus maximus and medius. So I'm going to come up, I'm going to find the trochanter here with my forearm. The other thing about the towel is it dampens my elbow. It's not as sharp. How's that there? Is that too much? Yeah. Okay. Now, if I hook that skin right there, you mean to pull to the back?
Yes, please.
There we go. Do you mean to go up?
No.
Or down?
Right there.
Right there. Right there?
Yes,
okay. Now, she is small enough that I can do this, and I'm going to demonstrate. I'm going to bring her arm up, and I'm going to wrap my other arm here. How's this? Now, here it's still to the back on the gluteals.
No, back up.
My controller is falling apart. Okay, so which one? You want more here or more here?
More here.
Okay, more pressure?
Yes, please.
Right in there. Not too much?
No.
There we go. Do, 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 do. I sing. Prevents the clients. It's still right there in the gluteals?
Yes.
Now, this is really the primary thing we're working on. What I call this is secondary and tertiary components. I just did that because I can start to reach now. As long as I've got good pressure and angle here, feels pretty good. Yes. Can I do anything to improve it?
No, that's good.
Okay. Then I can start to press in her neck. I can start to feel around her shoulders. I can start to do all of this additional stuff, including things like grabbing around her deltoids. How's that? You have problems with your deltoids there?
Or
tricep?
Yeah.
Now, if I just want to focus on this, that's totally fine. People have had discussions with me about whether it distracts the client or those sorts of things, and I don't really know. I don't have like a very distinct scientific answer for that specifically. I just go with what she goes, oh. I follow that to wherever the session leads, and usually there's a big tip at the end. So I'm going to come in again, and this time I was a little more broad along the ulna here. I'm going to come in just a little bit sharper, right in the side. I got a peep out of her right there. Okay, is that too much?
No.
Okay, not too sharp?
No.
So I broadened just a little bit because I found an area, even through the towel, just feels a little tight. A little bit of tension there. So right there?
Yes.
Okay. So to the back or down? Down. There we go. Now I can use the other forearm. I can reinforce. All sorts of options. I can also just work on my forearm extensors that way because I'm pinning my own arm. How's that?
That's good, thank you.
You don't have to tell the clients that you're tricking them into working on you, but it works. Again, right to the side, it's more lateral. How's that? Not too much?
No.
Better than the other spot?
No.
Just different?
Yes.
Okay. So you guys know this as well as anybody. You guys are massage therapists. There's nothing around the greater trochanter, around the sacrum. Anything through the gluteals is gold. Most people need work on it. If I want to come more to the back, down towards the tailbone, how's that? Cool. Is that a better spot than on the side?
Yes.
A little bit? Okay. So I'm going to grab with my forearm. I'm kind of angling down like along the sacrum here. How's that right there? There we go. And still down towards the tailbone.
Yes, sir.
And my elbow is facing down towards the tailbone. I'm literally going back straight towards that. Now, if I go forward or back?
Forward.
A little more forward? There you go. How's that? There you go. Now, this hand's free. She's like, man, I had problems with my tricep. Woof. Woof. Right in here. Right in here. Right in there. How's that?
That's good.
Now, the good thing is she forgets about her gluteals as I'm grabbing right here. But it really depends on the client. So, for instance, when do we use a compression or when do we use like a stretching or mobilizing move? Really just depends on the client. Everybody can be just a little bit different. I let you lead me into whatever I think the issue might be. Because she was having a little bit of issues with her knees, can you tell me real quick where your knees were bothering?
Usually it's in here and go bring it down. I can usually feel it like when I squat.
Do you feel it underneath your kneecap?
No, it's more on top.
More on top?
Yes.
Okay. That sounds more like quads to me.
Yes.
But I'm going to do this real quick just to change it up. So go ahead and just lay on your back. And I'm going to leave the pillow there for you. And then do you have one leg that bothers you more than the other?
No.
No? Okay. So I'm just going to work on the quads real quick. And then I'm going to figure out very quickly how I want to do this. So there's lots of different options. I usually will go for the option that I think is almost more intimate. And I know this sounds strange, but we've already built rapport. My client's completely clothed. I'm completely clothed. We're communicating. Now, this might not be the first thing I would do with her, but what I'm going to do is come in, I'm going to bring her leg up over, and now my leg is the bolster. I'm going to put a towel down so this isn't so sharp, and I'm going to start to hook into her quads here. You can see her leg lifting. Let me try that from a different camera angle. You can see the guy lifting up as I press. What do you think needs more pressure? Do you think it's up high or towards the knee?
Right there.
Right there?
Yeah, it's more like towards the
Okay. So I'm gonna reposition her. I just want her to feel comfortable. Does that feel like your leg is relaxed?
Yes.
This isn't hyperextending her knee. I love this because, again, this passive body contact. The passive body contact feels very nurturing, feels, I think, very supportive to the clients. But again, you just have to be kind of mindful of like the clients and cultural context. You work in a spa, a little different than a chiropractor's office or a clinic. So when I came in and found, it looked like it was kind of 1/3 the way up, about in there.
Yes.
So fingertips are kind of sharp, right? I'm gonna use a big broad forearm. Now you tell me, right there?
Yes.
Okay. Now, more lateral or
Yes.
more medial?
No, lateral.
More lateral. What do you think there?
Yeah.
Okay. Now, am I still shearing up towards the top of the femur? Up towards the hip? Is that too much?
No.
Do you feel any referred pain into your knee?
No.
No. Okay. Can you do this for me? Can you gently straighten your leg? There you go. And then let it relax. There we go.
Okay.
Sure, if you want to.
What?
Does it feel like it's helping?
Yes.
Okay. What if I rock a little bit? Does that feel good?
Yes.
Does it feel like it helps?
Yes.
Because we're working here and we're getting to like deeper layers as her body lets go, but her ibrometer started to go off because I'm kind of at her edge, right?
Yes.
And still lateral? Okay, and still up towards the hip?
Yeah.
All right. Do you need more pressure than that?
Yes, please.
Okay, she wants more pressure, so I got to change this up real quick. Now, guys, I want you to understand, if you're here with me live, one, there are links down below this video so you can pick up the full class. I started to just improvise a little bit. I want to give her some work on her knee. Just showing how I do that. I'm going to bolster her here. How's that? Pretty comfortable?
Yes.
Good. Okay. Now, the cool thing is your shins are big elbows on steroids. So I'm going to come out to the side here. How's that?
Good.
Okay. Is that too much?
No.
Okay. Too much? A little bit? Is it a little bit too much? It's a little bit too much. I was not using my hands. It was a little bit too much. So I have to stack body weight. How's that? Okay. Now, you still want me to shear up?
Yes, please.
Right there?
Yes.
Okay. Can you lift and lengthen your leg now? So straighten the leg. Can you pull your foot back towards me? There you go. Now let it bend. There. Is that helping? Or is it too much?
Last one was.
Right there. So I had to lean off with my hips, just the way I lean off with my shoulders, right? When I forearm, shin is big forearm on steroids. I'm a little more lateral right here just because of the angle. My knee is up, my foot is down. Still up. Right there. Now, what do you prefer, the forearm or the shin?
Shin.
Why?
More pressure.
But I'm not even working. And that's what I'm teaching. Essentially, I'm teaching Brazilian Jiu-Jitsu to an industry full of boxers. And they come in and say, my hands hurt. And I'm like, oh, we have a different way. Let's change it. So I'm going to disengage just for a second. That's a big, broad compression. If you guys aren't familiar with dealing with that, I'm a little bit more along vastus lateralis right there. I'm going to go just a little bit higher into here. And see, already she's giving me that little bit eye barometer. I'm assuming this was an issue. So here's what I'm going to do. Because I can put so much pressure, I'm going to double this guy up. Even more cushion, right? So it's important to note, I'm not just pressing with my tibia. I'm really pressing with like my tib anterior. It's like the forearm flexors. Your shin is a forearm on steroids. So I'm going to come here. How's that? Too much?
No.
Still up? Okay, more lateral?
Yep.
Right there?
Yep.
Is that too much?
No.
Okay.
If you go anymore, I'm probably gonna jump off.
Okay, so what if I come in here? How's that?
That's good.
There we go. I'm losing my controller again. It worked really well when I tested it. Too much? Can you straighten your leg at all? And I'm going to slowly back off. It's a big, broad compression. There's a lot of body weight there. How's that feel?
Good.
Cool. Let's go ahead and have you flip to the other side. I want to work your gluteals on the opposite side. Does it feel like it helped with the knee at all?
I'll find out when it's tomorrow.
She'll find out when she squats tomorrow.
I'll text you.
We'll get a feedback loop there. Let's see.
I mean, I could feel
So,
it referring
where did it refer to?
down to my knee.
Okay.
The outside of my knee.
Yeah. So when she says that, that's the real thing I was looking for. When she says, oh, it referred down into that area I was having a problem with, that's really what I was looking for. When you can find where it's referring pain, that makes the biggest difference in my experience. I'm going to come around opposite side of the table and make sure I got my nifty communication device there. I'm going to sit. Now, I don't know if I did this on the other side. How do you feel about me sitting on the table right here with you? Now, but we built up.
Exactly.
This has been like 45, 50 minutes already. She's more comfortable than when we began. And I'm using this, one, to be able to dampen the pressure on my elbow. But I'm also in a position where I'm trying to make sure she feels covered and like safe and protected for the sessions that we deal, okay? So I'm going to come in, I'm going to find the trochanter. It's about right there, the greater trochanter of the femur. And then all this stuff in the gluteals, I'm just going to come around. See where I can put pressure. How's that? Good. And this is kind of just kneading through the gluteals, working towards, I think, maybe gluteus medius from a different angle. I lift myself up just a little bit. How's that right there? Okay. Is it more to the back?
Yes.
More down? Right there?
Yes.
Okay. No more pressure than that? Okay. So she wants more pressure, so I'm gonna do this. I'm gonna press into my feet here, and I'm gonna lift my body up just a little bit because I'm trying to stack body weight. There we go. Good there?
Yeah.
Still to the back? There we go. Now, me pressing on tissue here, trying to manage our communication. When I'm pressing again, we talked about Gluteus Maximus. I think I have to restart here. There we go. So dealing with Gluteus Maximus, big guy there. Now, is that more down for you? Right there?
Yeah.
More to the back? No, it's right there. Yeah. There we go. Do you want more point now?
No.
No, okay. So I'm hooking into Gluteus Maximus, but then we talked about the fact that Gluteus medius is a little bit more lateral, and I feel like it's the gluteal muscle that's unaddressed. It's kind of hidden on the side because therapists are working prone and supine, which you've noticed so far, we've only been during class so far, side lying. Side lying completely changed my entire practice when I really started using it. You'll notice that of the workbooks that I wrote for Thai massage, the phase 2 workbook was the longest one, side lying. Still down. What if I give you a little more point? Too much? Or is it right on improved? Is it better than the broad?
Yeah.
Okay. And you'll notice that I let her choose. Doesn't matter to me. Doesn't matter to me at all. And a little bit down. Not too much. Okay. The good thing about being able to stack my body this way is it's very easy. You can see that my hands are just completely relaxed. I'm trying to stack body weight as much as I can to be able to do this, not only in a way that is effective for her and her pain, but also feels really nice to me. I'm going to go ahead and turn this around. And what I'm going to do is same thing, but I'm going to come in with the other arm. And I'm going to do this, I think, along the sacrum, because when I was over here, it was more like this direction. I'm going to come and grab along the sacrum, trying to figure out what camera angle to use. And I'm going to grab right in here. How's that? Okay. You like the broad? Okay. And then down towards the tailbone? Okay. Now, do you want me to kind of go forward or go back towards the spine? Okay, do you need more point? Okay, so to give her more point, you guys know how to do this. I'm gonna slowly, how's that right there? No more point than that? No. Okay. I'm just stacking body weight to be able to deliver pressure in a way that feels effective for her. In my experience, the clients don't mind that I'm asking for feedback about pressure. Once I've developed more of a rapport with her, it'll be easier for me to work on things and know that I'm not using too much pressure. I'll know her body's limitations a bit better, and then I can just check in when it's needed. I think a little more point right there. Still down towards the tailbone. There we go. Do you need to take a bathroom break? No, okay. So here in just a second, I'm going to give you guys just a minute. I'm going to go over some quick anatomy again, just kind of talk about what we covered. We're about to repeat so that the giver can receive, the receiver can give. And let's slowly take that off. You comfortable just staying there? Yeah. Okay. I'll come in and just kind of work on it again. Same basic stuff. So when we talked about the anatomy, I just want to cover what we were, dealing with again, just very quickly. So when we're talking about trapezius, we were lengthening that upper portion, pulling the shoulder blade back and down. Then when it came to levator scapula, which is going to go up into the neck as well, we were lengthening that muscle, pulling the shoulder blade back and down. Now, the one thing I didn't go into excessive detail about, even though I talked about it a little bit verbally, is essentially when we're working those two former muscles, we were really pulling pec and pec minor open. It allows me to work on her through the chest to be able to open those structures without doing any specific compression. We were mobilizing to access pec and pec minor, which cause a lot of those issues with what we talked about in the upper back and neck pain stuff we see. So when people are having issues, 9 times out of 10 when they're having upper back pain, those are some key core muscles I like to address. The things that I think are actually weak in many instances are the traps, because they're not strong enough, that part of that posterior chain. And then also it's the rhomboids. I think that the rhomboids are lengthened. They're not as strong. The muscles in the anterior chain, the front, are the ones that are inordinately tight. So if you guys haven't already, you can take like a quick bathroom break. Just want to cover what we did. We're going to go right back into it where we're going to deal with the upper back and neck again. Talk a little bit more maybe about the intake. I have a tendency to make that intake very verbal if I can at all. I really prefer that, and I think it means that I'm able to connect with someone before they get on my table. What that does for me is it allows me to develop a rapport verbally with the client before I'm in a situation where I'm actually putting hands on. People usually get inordinately comfortable with me very, very rapidly, I think because of my rapport, or I should say, they figure out whether they like me or not. And the ones that don't go away. But what we're going to do here in just a second is go back and repeat with a little bit more nuance, maybe this time. I want the person who was giving to receive, and I want the receiver to give. And then I'm going to come in just like before. I can grab her arm. I'm going to roll her back and open. How's that? There we go. So if you guys have not exchanged yet, I want you to go ahead and do that. I try to do a little bit, you know, both sides, so the model doesn't walk out of here, you know, lopsided. Is that comfortable there? Yeah. But you still like the down.
Yes.
Yeah, the down pressure. So I'm bringing her back into neutral, and that's where I'm going to come and sit. And again, I can slide off my shoe. I'm going to sit with my glutes, basically, or sacrum, right up next to hers. This means that she has this full body support. It means that as I work on her, she knows that she's not going to fall off the table because I'm pulling her back and open into myself. And let me see here. Positioning. I'm going to come up. And if I grab here, so I want you to tell me in your case, like, how does this feel the second time? Does it feel any different? What feels different about it?
There's not as much.
Yeah. Gonna hook around the shoulder blade again in her case. Own entertainment, just like we added the quads in. We talked about like primary, secondary, and tertiary. I use this language a lot because I find that it really works for what I'm doing. But you know, this is the primary movement. Pulling her back and open in her case. Then when I bring her down, I've got this big broad structure of the rotator cuff available. I can feel part of her bra strap here, and I don't want to press these little plastic grommets into her skin, so I'll sometimes just pull that to the side. I'm going to hook a flat fist right into her rotator cuff there. How's that? Right through there. Now, just took, 10 seconds, 15 seconds, 20 seconds, however long it was. Now I'm going to go right back into what I was doing. I'm going to grab onto her shoulder blade again. This one feels a little tighter to me. Ah. Right there. Pull back and open. And pull back and open. And what do you think right there? There we go. Now, if I keep that lift and then I roll you back and open, better there? There we go. Now, I'll just by nature, by habit, look over her eyes, because I'm trying to see if she's making like any facial expression, like what I call the eyebrometer going off. Now, what if I maintain some of the pull down, but I kind of roll back and forth? Feels okay there? Or you prefer when I bring you more to end range? Okay. So in her case, she actually likes, how's that? There we go. Because I've rolled her onto my leg here. I can like lift her head basically with my shin. Back, open and down. And this is very common to me where in her case, I'm working on her the second time. I'm getting a little bit more open, a little bit more mobility than we did the first time. That's extremely common working with clients where I'm trying to address something. I'm going to press right into paraspinals, rhomboids. Oh, how you doing? Oh. Opening the chest. But I still want to touch in these areas, even though I think, again, what did I say? I said I think these muscles are actually weak. But I still want to go in and address those because I want the client to feel heard. I want them to feel like I'm addressing the things that they came in for. If I don't do that, there's a much greater likelihood that they're not going to return because I don't know, if I need an oil change, how do I feel even when they come and try to give me the offers, I'll change your air filter. And I'm like,
Ask for that.
Exactly. But we're in the position where if they say, hey, you need to change your oil. But he says, hey, listen, we changed your oil. Come look at your car. And he says, I want you to take a look at this. When I open this up, your air filter, I think it looks like it's fine now, but you might need to change it next time. I have a different response to that mechanic. He's a good mechanic. Mm-hmm. And he's like walking me through the process. He's not scaring me because I have a lot of anxiety. My car won't work, right? Because I know a lot about cars. I'll fix cars. I can fix a meal or a bad back, but that's about it. So I'm trying to operate as a good mechanic when I'm with the client, and being able to give them information about what's going on, I think really adds to that process. As I was pulling her again back and down, we were talking about, once again, lengthening trapezius, that upper portion particularly. That upper portion, you can see it go all the way to the base, acta occiput, at the base of the skull. That's a constant issue for people, and something you absolutely want to address in session. And then the next piece is, again, from that position, levator scapula. I think they're two of the areas that we're just inordinately good at addressing, using that mobility, using that lengthening, and using that stretch. I sometimes use those words interchangeably. So the amount of length, the amount of pressure, the amount of mobility that you get from someone can be wildly disparate. Everybody can be just a little bit different in the amount of pressure that they can take. I'm going to come in and give her a little second pass through the rotator cuff. This just gives her a break for a second. What's that? Lifting weights, working on infraspinatus, working on muscle through the upper back. I sing a huge slew of Disney tunes in session. Right in there. And then this also is like again, it's that juxtaposition, like working one area and then switching to something else. I'm just going to reposition myself. I'm going to bring my leg back up and over. And pull her open again. Pretty good through there? There we go. And in her case, I can get a really good grip on her shoulder blade here. I can actually, just lift her. If you can't get a grip on the shoulder blade, I'll often do this. I'll use the right hand to just pull, kind of jostle. Some people tell me they like the word rocking more. They have like an aversion to the word jostle. They feel like jostle's what they do with the milk in the back seat, and they're like, I don't like when stuff jostled. I like when it's rocked. I'm like, oh, okay, yeah.
This one being more nurturing, rocking.
Yeah. So I'm getting her to let go of her shoulder blade, to give it to me, to be able to lengthen those muscles that we just showed, particularly the upper traps, levator, scapula. Then I'm grabbing around the shoulder blade. I'm going to pull her back and open again. My leg is there. I'm tricking her into letting me stretch my neck, using her body weight as resistance. And what do you think? Down towards the tailbone? Still good? Yeah. She's got a little bit of lift off of the pillow there. And I'm going to bring her back to neutral. Again, we talked about, even though I can go in and press into the rhomboids, pressing along the shoulder blades there, that's really, really good. People like it. They like, feeling pressure along their shoulder blade there, where rhomboid major and minor are. But also, a lot of what we're doing is actually opening the pecs. We're able to lengthen pectoralis major and minor and pull them back and open while we're working. I think adding the anatomy just as a little bit of grabbing what we're doing, giving it a little bit more nuance and detail is helping me describe why I think the work is so effective. And then what we're going to do in her case is I'm going to have her switch sides. I'm just going to have her flip for me. And see, my first notion is to thank her for coming out, thank her for being the model, and I'm like, dude, she gets 2 free hours. I mean, it's cool, thank her, yes, but I mean, were you like, oh, I only get 2 free hours? That's basically, yeah, exactly.
I'm on my 3rd.
Yeah, there you go. Comfortable there?
Yes.
There we go. And then I can just move any of my bolsters or stuff, out of the way. So when I come in, just like before, she's got a little more familiarity. This is the second time with her going through. And roll her back and open. This also allows me to sort of test her range of motion. Some people, you'll take them like this, and you'll go to right here, and they go, oh. And I go, oh, are you okay? And they're like, dude, I just feel that in my upper back. It feels so good. And I'm like, oh, because then I'm communicating, and I'm like, listen, right there, it's almost like I'm using movement. Like when I pull now, this is the second time you received. Where do you feel that? In her neck. And the reason I want to point that out is I'm touching right here. I wasn't even touching up in her neck, but I'm using mobility to mobilize, and she feels it in her cervical spine. Some people will tell me, oh, I feel it in my shoulder joint. Some people will tell me they feel it behind their shoulder blade. Some people will tell me they feel it in basically their upper thoracic. She's actually choosing somewhere along that kinetic chain, which is in her cervical spine. I don't make any judgment about where she feels it, but it's very good to try to figure out where she may be holding tension. Even though she doesn't have a problem with her neck, I suspect she's got more neck tension than she thought. That's just my guess. Yeah. So I'm going to come in again. Can I get you to scoot just a little bit forward there? There we go. I had her scoot forward because I need a little bit more room here on the table. I didn't want to be in a position where I couldn't move her around as easily. So I needed a little more room so I could sit. I'm going to slide off my shoe. I'm going to come in and sit right along her sacrum. Then I'm going to hook that arm up and over, usually about elbow to elbow, but it depends on the length of the legs, the person, arm length that you're working with. I'm going to start to get this to let go. She's already pretty soft. And right there along the shoulder blades. Right in there. Right in there. Am I killing you? It does feel like shit. Nice. That's the second.
Earmuffs, buddy, earmuffs.
Right there. A little tender. Yeah. So what I feel is just a little more nuance. This is a second pass for her, so it's like a little deeper. Feels like it's got a little more specificity. And what I'm doing is I'm just hooking my fingers and rolling her onto my fingers. rolling her onto my fingers, rolling her onto my fingers. I'm not really pushing in so much. It's more like what I call receiving the client. I'm pulling her into my hand. Is that too much when I roll over?
No.
There we go. Feels good?
Yes.
And right there. And a little bit higher, a little bit higher, a little bit higher. Oh. She can feel it in her lungs. Who knew? We're massage therapists. We work on lungs. When you say you feel it in your lungs, like what do you get?
Pressure again?
Pressure?
Yeah.
Is it
pressure.
sharp?
No, it's not
Broad?
bad pressure. I just can feel it.
Just feel it. Okay. Now, the other thing is, she says she feels it in her lungs. Like, that's interesting. I don't know if I've ever heard that descriptor before. So I was just inquisitive, which is a constant thing in session. And then also, is it like something you want me to repeat?
Oh, yeah.
Yeah.
It's good. It's just not something that I guess I'm used to.
Yeah. But the thing is, she feels it in her lungs. When we're opening up pec major, pec minor, we're opening up the rib cage.
Mm-hmm.
These muscles are all wrapped around the rib cage, which in most people's pulled into what I called is that kyphosis. So I'm going to grab here around her shoulder blade. I'm going to pull her back and open, back and open, back and open. How's that? The other really good thing about this sort of work when people are clothes on, one, you could film and photo document nearly everything for your social media. Two, it's really easy to show off. It's really easy to go to a gym, go to a chiropractor's office somewhere and set up and work on the public because everybody's clothed. When you pull up to the back, or do you want like straight down towards the tailbone? Towards the back was better. Okay. I'm going to change the camera angle here. And I'm grabbing with the just above grip. How's that? There. More than that? Okay. So in her case, she actually wants more. I'm actually going to grab around the shoulder blade. I'm almost going to lift her and then roll. There we go. Then roll her back and over because she was asking for more. How's that? How does where my leg is positioned feel? How's that? How's the rocking there? The rocking's nice. The rocking's nice. It looked like she's dead. We killed one.
You have to let go and give it to you.
The clients never listen to us. And then still the back is better than down towards the tailbone.
Yeah.
Yeah, you like the back more.
I feel like it's more contact. Go to the back.
Is it because of the leg?
Oh, yeah.
Yeah, just a more pressure. Yeah. So what I'm going to do is I'm going to go ahead and flip it out. And when I say flip it out, I'm going to come up to the head of the table. I'm going to put my shoe back on. I want to go ahead and give her some pressure in compression form going into the upper back and neck. And let's see here. I got to reposition everything. I need a little floating stool. There we go. So when I come in, I'm gonna have to change angle and leverage. So when I'm doing this, it really depends on the person I'm working with, like what's gonna work best. I'm gonna pull the chair in pretty close and see if I lengthen away with my right hand, creates a little length in those muscles. And then I'm able to come in and see if I can put some forearm pressure, this time with my left forearm, right there. How's that? Is that too much?
No.
No. Right there. And you want more to the back. It's always the fun part. What camera? So I'm going to reinforce. I felt like this arm was like working, okay? So my deltoids, I'll remember anatomy in a minute. I only teach this stuff. My tricep and my deltoids are working. So what I'm going to do is I'm going to reinforce with my other hand here to be able to lean in. How's that? Okay. Do you want more towards the back?
No.
Okay. Right there?
Yes, please.
Now, more down towards the feet?
Yes, please.
There we go. And there was a little bit of like what feels like a lift, but essentially I was pushing my ulna down towards her feet. She told me where to go when I gave her the option. We might have been 50% there, But that little bit of nuance and communication goes a really long way to making sure we were in the right spot, giving her what she really wanted. And again, as we're working here, you can see that primarily what we're pressing in is that upper portion of trapezius, that cervicothoracic junction. Almost everybody wants pressure in here. Then that next muscle, real deep compression, is getting some good portion of levator scapula. All the while, we're just leaning in, using compressive force right into that junction. A little more lateral, or is it more kind of down? Front? Oh, we got a front this time. That rarely happens. Right there? Yeah. There we go. Starting to feel a little bit of tension in my arms just from using that left side. To change that, I'm going to back off and I'm going to slowly, one, it gives her a break. Two, it allows me to just go ahead and change arms because I don't want to do anything that feels like it's jeopardizing my body. You want to build strength. You want to build ambidexterity. You want to be able to move and do the things you need to do, but I'm absolutely adamant that therapists can't hurt themselves. If your work hurts, contact me, we'll do a private class like this. I have to be able to show you how to use body mechanics in a way that's not going to injure you. I'm actually going to move my position just a little bit and move where my chair is so I can change my body position. Now I'm going to lean in with the left arm. And as I lean in with the left arm, I'm going to come in with the right forearm. You tell me, about right there? Okay, not too sharp? No. Okay, right there. Now I'm gonna reinforce again with this other hand. So I can reinforce here. And then what do you think? A little more to the back? Okay, and then what, down towards the feet? There we go. Now, if I want to stack body weight, I can lean this way and I can actually bring my arm out. Is that too much pressure for you? No. Now, this allows me to open my chest here and kind of open through my left side, which is more problematic for me. I can kind of roll through my shoulder joint. Now, she doesn't know that I'm doing this. All she feels really is a little bit of maybe some shaking or rocking right there, and then maybe a little bit more pressure because that arm is up. But I don't want to put myself in a position where I'm slouching all the time, especially working on clients. Like, I don't want to recreate that kyphotic posture that we see in clients by working on them. We can't create the thing we're fighting against. That makes sense? You remember Jesus? Yeah, I mean, let's say it again. He always brings up Jesus. We don't understand. A house divided against itself cannot stand. Oh, that's right. How's that right there? There we go. A little more pressure there. There we go. And she liked this reinforced pressure. I'm going to roll just a little bit more to the back. How's that? And is it still kind of down towards the feet? There we go. And now you're going to completely laugh at me because did we work the other side yet? Did we? So we worked for the second time, we worked lengthening you Then we put you on this side and did a compression.
Yes.
Okay, so I am in order. I'm not completely insane.
Yeah, no.
Let me go ahead and have you flip sides. Because I will forget what I'm doing.
No, we can both have twice.
There we go. And I'm just going to position you how you feel there. Comfortable?
Yes.
All right. So again, this is just a compression. I'm going to go right back and up. And I'm going to see if I need to change the position where my chair is. Again, we've got, oh, that feels much different than when we started. I'm going to press down and then come in. This time I'm going to stand just to give it a little bit of nuance. How's that right there? Okay, not too much? There we go. And then back and open. Okay, is it more down towards the feet? Okay, so I kind of dropped my shoulders down. How's that right there? There we go. Every body positioning will be a little bit different. What the client prefers will be a little bit different. I don't particularly care what position I'm in so long as I feel comfortable. I just want to be in a position that feels like, one, it's most effective for the client, and two, is most effective for what they are dealing with. I don't want to be in a position where she feels like she's not, so to speak, like getting her money's worth. How's that right there? And more to the back, right there. There we go. And still a little bit more down towards the feet. And what I did was I brought my head down. I don't know if you can clearly see that. It's like I was stacked up high, and to give her a little more pressure, I'm just gonna sink down so that my forearm feels like the ulna is pressing down more towards the feet, right there. There we go. Oh. And as that arm starts to get a little bit tired, I'm gonna back off. And again, just like before, just gonna switch arms. I'm gonna press down with the left hand and then put the right forearm in. Notice I switch side to side. How about right there? Not too much. And then more down towards the feet. And then does that feel substantially different? Okay, in a good way?
Yes.
There you go. Now, she just told me this feels better, and I got to sit down. Yay. I don't have any issue sitting on the table, getting on the table, to be mindful of where you work in cultural context. I want you to think of the tool as just a piece of equipment, just like the mat is a piece of equipment. I don't really care where I work, so long as I get access to more tools. Even if you're going to try to build a mat-based practice, you have to do so by usually starting people on the table. The clients, all they want to know is what's in it for them. So why would a client want mat-based work? More mobility, more compression, deeper compression. And what I would often say is, they'd say, well, I want deep tissue. I'm like, this is deeper than deep tissue. Ooh. More to the back.
Yes, please.
Okay, or more down towards the feet as well.
Yes, please.
Right there?
Yes.
There we go. Little minor shift. I verbally said what I was doing. Probably imperceptible on camera. And my arm was just starting to get tired. I'm gonna come out And then in this case, we did kind of the mobilization and stretching on both sides. We did the compression with some shear on both sides, correct?
Yes.
Okay. Now I'm going to go down into the gluteals. So I've got to reposition myself. I'm going to grab my handy dandy towel here. And I think in this case, I still want to use this just for a little bit of elbow protection. It's going to make it just not quite as sharp when I do it this way. I think that's probably going to feel really good to her. So we're going to try that and see. I'm going to come in again from a seated position. Is that right there? Not too much? Okay. Let's see what a camera angle we should be on here. Oof. Oof. So I can feel like a little more detail this time. If I'm stacked right there, how's that? Okay. Is that more to the back and then down? There we go. It's like I've grabbed a section of the gluteals along like gluteus medius using the forearm, a little bit of the ulna towards the elbow. And again, primarily what I'm grabbing is I'm sinking into Gluteus Maximus, really hooking into that more superficial gluteal muscle. And then very slowly, we're trying to sink down and through to see if we can get a little more access to Gluteus medius. Because it's on the side, because it's more lateral, it's a perfect place to be able to compress, hold right there. You dying? Not too much? Okay. More to the back. And then again, is a little more down. There we go. Trying to stack body weight in a way that feels comfortable to me. I do use muscles, I use my body, I maintain my mobility. I really think that I'll be able to do this stuff till I'm dead. Even at 18 years, I don't even feel close to done. I'm 43. Like I feel like I could easily do this into my 70s and 80s with no issue, maybe even beyond that if I really wanted to. What do you think? More down? Right there? So do you see the little nuance? Like they can't see that on camera, but it was just like changing the angle a little bit, like the vector and pressure, and then sometimes sort of shearing. So like to the back or the front. Okay, just a little bit right there. And then what do you think? Down? There we go. Those little bits go further to help people in chronic pain. They're going to be in this co-creative process with you of reaching into an area and being able to address something deftly. You're going to really be able to go ahead and sink into that area to address what they're having a problem with. And just to change my position for a second, just to give me a break, I'm going to slowly come back and out. I want to see if I can hook. Again, I was using in that case my right forearm, but I want to come in with my left and see if it changes things in a way that's going to work well for her. So I've got my elbow facing away from the tailbone in this instance, right here. Okay. Now up towards the spine or down towards the tailbone. Okay. Hook again. Is that too much? Okay, how's that? Okay. Do you want me a little forward or a little bit more to the back?
Yeah.
Right there. Is that it?
Yeah.
There we go. Now I'm gonna, just for a second, she gave me a little bit of a facial expression, a little bit of a wince. I'm gonna rock. It's like I'm grabbing skin and rocking it over and around her sacrum. How's that? Is that preferable to me holding static? You like the rocking?
Yeah.
Now, I don't make any judgment about what she wants to receive. I'm trying to do stuff that feels more effective. I have absolutely no double-blind research study that tells me that rocking is more effective than static compression. what it is I'm just asking her about what I'm feeding into her nervous system as a stimulus, hoping that her nervous system responds with relaxation. How's that? So now I get to take a break because I was moving. I'm using more muscle. I was rocking. Now I'm in a static compression with a little bit of shear. I also feel like an interesting line of like stretch along my right leg because of my hip position where I lift my quad like I'm doing yoga and I plant the outside part of my foot, and then yeah, I lengthen my spine, and exactly. Body awareness. So with your knees on both of them, you tend to feel in the front and underneath the kneecap. Okay. And I almost emphatically assume that is just the quads giving you some issue. Let me go ahead and check and see what our time is. Do you want to go ahead and flip to the other side? Yeah. Cool. I'm going to move my equipment. And I'm going to cover this hip. We're going to bolster her again. Usually it'll work really well if I can hook underneath the hip there. You feel supported? Yes. Good. I'm going to go ahead and put this in position. And now I'm just flipping to the opposite side. You know, same basic stuff, just slightly different position. Going to come in and we're going to see. And again, greater trochanter. Still feels a little bit of right there. And that to me is a little bit more medius. Again, I'm going to come in and hook. I'm going to stand for this first portion. How's that? Okay. Towards the trochanter or up? Up. Up. Towards the iliac crest, I think. Right in there? Yeah. Okay. Now if I hook in, do you want more to the back? Okay, and then down? Yes, please. There we go. Is that too much? No. All right. Now again, what we were pressing in, and I want you to be aware of this. We talk about the anatomy. We're going to cover it again and again through these classes. We're getting into gluteus medius, but gluteus maximus. Gluteus maximus is the more superficial muscle. It's the big guy on top. We're slowly going to wind up working into gluteus medius, and the gluteus medius is just a little bit more lateral. And because it's more lateral, what I'm able to do is use this sideline position to compress and sink down. Remember when I was asking about along the iliac crest there? We're going a little bit towards that upper portion to be able to access that on Chris. Right in there. And still to the back. Yes. Okay, and then down. Yes. There we go. You'll notice that I've gone from arm to arm, back and forth, different positions. I just want to feel comfortable while I'm working. I don't want to be in a position where I feel like I'm jeopardizing my body at all. If it feels uncomfortable, change it. You have my permission. The other thing is, since we're working at a distance, I can't see, so there are some instances where you'd have like wildly disparate proportions to the person you were working on. Maybe you have, you know, really, really short limbs and they have very long limbs. So I sometimes have to change things to be able to represent what we're doing in session. I was getting just a little bit tired in that one position. I'm going to move down a little bit more along the sacrum right here. What do you think? Down towards there? Down towards tailbone? Yeah. Is it more towards like the midline, like more towards the spine? Yes. Right there? And then still down? Yes. There we go. One of the things I find most interesting is the clients loved this stuff when I broke it out on them, and I just politely forced them into it, like I just by strength of will. The difference was I got very comfortable very quickly and went, why do we have people take their clothes off? And that was a really weird like breaking point for me in how massage therapy and the services were delivered. Just a very different thing. Yeah. What do you think? Down towards the tailbone, a little bit sharper. Now my towel slid because of like the texture of her pants. Like I'm just gonna reposition myself. I'm gonna see if you want a little bit more point. Because we built up. Let me go a little bit higher and hook in there. So I'm still feeling. Now I'm feeling through the towel, and I just wanted to point that out. If I hook right there and then shear down, how's that? There we go. Oh. So there are also deep lateral rotators. We may go over some of those in later classes along with slides so you guys can get a better idea of the anatomy. I just wanted to grab some to be able to give a little more anatomical specificity to what I'm having you guys do. I think sometimes, even though I can see it mentally, I think it was getting lost in translation. The graphics really allow me to bring more specificity into the education I'm delivering with you guys online. I very, very much feel that online classes and in-person classes are merging. We're creating a sort of hybrid that I think is actually much more effective and also allows the students not only to study with me continuously, but to also study a lower price point. Chris, right there,
yeah.
Down. And is it more like towards the midline?
Yeah.
I'm getting down almost feels like towards the tailbone, right?
Mm-hmm.
Okay. Just hooking the tissue right there. Chris likes the online classes, but she likes it because she receives for 2 hours. We should raffle the model. Give the money to charity.
Oh yeah. You know how like they used to do like raffles for like dates?
Oh yeah.
That's what reminded me of.
Is that legal now? I don't know.
think so. I'm pretty sure that's called sex trafficking.
So I'm gonna release for just a second because I'm using my arms, right? I think I'm still gonna use this left arm, but I'm gonna sit. I'm gonna just get into a slightly different position. The trochanter is here. I was a little bit more initially kind of above and lateral, kind of gluteus medius. I got down, I think, almost to like gluteus maximus along the tailbone. Now I want to go up just a little bit, but still posterior to the trochanter. How's that there?
Okay.
There we go. Is that too sharp?
No.
Okay. Now from there, still kind of down?
Yes.
There we go. And is that back towards the spine?
Yes.
There we go. I love, love, love being able to stack my body in a way that feels just inordinately comfortable to just, hang out. I spent a lot of time thinking deep thoughts. I used to do it as a philosophy student. Now I do it as a massage educator, pondering digital distribution in the internet era via live streams, which we could do every day, globally, every day, globally, every day, globally, every day, globally, every day, globally. Did you hear that? Every day. I need a graphic. Every day, globally. What do you think? More down? Right there? There we go. So again, I'm down along the sacrum, but I want to just point out again, if you could take a look at the screen, I'm just grabbing into those portions along the sacrum, down closer towards the tail, moving various directions, but that really feels like what I'm grabbing there. And then I'm grabbing the nerves, the cutaneous and subcutaneous nerves related to that area, because what we're really doing, is we're feeding a stimulus into her nervous system and letting her nervous system respond. That's why I can't really tell you always do this technique. It really depends on what feels good to her. If I did this and she's like, this is too much pressure, this is too sharp, this is uncomfortable, there's nothing about her nervous system that's going to go, oh, I'm safe, oh, and relax. That's the situation that we're trying to create and that we're trying to maximize. Ooh. Ooh. Now, a little more point. Is that too much? Whoop. Start to slide again. Grab right there. How's that? There we go. Now, if you had a choice, if I did this like without the towel, what's like your impression of it?
As a therapist or as
Both.
a human being? As a therapist, I probably.
Okay.
But I do feel like it dampens it a little bit. If I was just someone new coming in, I probably would be someone, especially someone that's never gotten a massage before.
Yeah.
I'd probably be a little bit more.
Yeah.
Even with.
So when she says that she would probably feel just a little more hesitant, I have to constantly think about these things as an educator and how to deliver information so people understand. Being clothed and then having some sort of cushion like a towel, it does multiple things, both culturally and from a standpoint of like dampening the pressure of the tool that I'm using. I have to just maintain a little bit of that conceptually about what's going on. You know, as I go down and grab tissue, and again, we were just around the sacrum there. You know, you're getting down towards the tailbone. You're getting down to fairly intimate areas, but she's completely clothed. She's covered with a towel in addition. But it's performing, I think, multiple functions. The other piece is, as you became more comfortable with me in session, we might actually alter things to be able to, you know, it might be a little bit more intimate, but you might be a little bit more prepared, so to speak, for that, because we'd already developed a connection. You had worked with me before. You felt more safe and comfortable. Let's have you turn onto your back. And then again, when you have issues, does it ever go down below your knee or below your kneecap?
No.
No? Okay. And it always just feels like around the knees. You don't feel anything in
nothing in my quads.
Don't feel anything in the quads.
No. Like even like as I'm getting ready to squat, like my knees are like, all right, we're ready to hurt now.
Yeah. So the other thing is the quads. I don't have a graphic setup for this. I'll have to do this next time. So since you're having a problem with that, and I know now, we'll probably focus a little bit more on this next class to be able to go in a little bit more detail where I can show them a little bit of the anatomy. But like you might have no issue down towards the knee. We might work and then find out it's actually coming from up here.
And that's why I said I think it's more of my legs because like when I like would work on like my calves, it felt better. But like I don't have like if I press around here, I don't feel
you don't feel anything.
But if I press anywhere else, I'm like
yeah. So that's where we have to be fix-its. Like we got to be mechanics and like go in and try to figure out what, you know, what are they dealing with? Those are the conversations. And this is the thing. She's a massage therapist. She knows all about bodies. She can't even quite figure it out. I had a pain on the outside of my knee that was basically my TFL up here. Yeah. It took me forever to find it, probably a year. And when I found it, I was like,
pressing like
yeah.
up in like my forehead and stuff. Like, it's got to be somewhere.
So I'm gonna double this up. I love these blankets as bolsters because I can customize like their size. I'm gonna cover her again right along here. And this really is to dampen pressure. I'm actually gonna double that up again. I wanna make sure that this quad is covered. Maybe I just start with the hands. In this case, just to get a feel, because you liked pressure that was a little more lateral last time. So is it right there?
Yeah.
Okay. Now, as I'm sinking in right here, do you want more towards the midline or more lateral? More towards the midline. Yes. Okay, let me change position here real quick. Let's see. So, coming in right here. And then if I lean, again, more towards the midline. And this is really like the heel of my hand leaning down. I don't want enough pressure right here in my wrist that it feels uncomfortable to me. I can always switch out to using my forearm on steroids, but I'm going to start here. I'm actually going to just reinforce the hand. How's that? Is that too much? Yeah. A little too much. I'm going to back off a little bit. Okay. There you go. So more to the middle, more lateral.
Not more.
Right there. Okay. Do you want to engage at all?
No, I do not.
She's like, I do not. No, I do not. Now, I don't go, well, this has got to make you, no, it's like, no. So some clients want to engage. Some clients want to be able to kind of work through it. Athletes in particular, I think, really like being in a position where they can kind of work, you know, through stuff. So what I'm going to do is, you're completely passive. Is that too much pressure? Okay, it's still more medial, about right there. Now I'm going to do this for her. So this is a passive mobilization. I'm going to grab this leg and I'm going to lift. Is that too much?
No.
But her abrometer definitely went off.
It still feels like beep.
Okay, so if I lift you up here, does it feel like it's helping at all?
Yes.
So if it feels like it's helping, is it uncomfortable? Okay.
It still feels like
It's uncomfortable. Is it painful?
no.
Okay. And here's the thing. Some of that language, that's the thing you're going to have to get deft at, like dealing with clients. If she feels like it's too sharp or it's too much pressure, that's where it can get problematic, because she's going to recoil. She's going to tighten up. We're trying to prevent that recoiling, but when I bring you to here, it intensifies, but it's still tolerable. Intensifies, but you can still manage it. Okay? Now, in my case, this has started to put enough pressure on my hand that I don't want to keep doing that. I'm feeling that little bit of compressive force, so I'm going to change this out. I'm going to pull this guy out all together. Slide off my shoe. I'm going to come on in. I'm going to see if I can stack myself to be able to do generally the same thing, but with a forearm. You think about there? Okay. Is that too much? Okay. Right there. And is it more medial? No. Right there. Okay. So when you say down, you mean lift up and then move?
Like,
or you mean up towards the hip?
no, more like in here.
More lateral?
Yeah.
Okay.
But like
Okay. There we go.
Yes.
So she gets confused with like, hey, what are we doing? You know, and I get confused. What are we doing? The absolute worst is left and right. Because let's say also that I've got multiple points of contact. Let's say I was doing multiple things at once. If I say, hey, is it too much pressure? She doesn't know what I'm asking. Like, too much pressure where?
Mm-hmm.
Does it make sense?
Yeah.
So what I do is I say, hey, is that too much pressure right there? I use a kinesthetic cue because they don't have to really think about what side or what's being pressed on. How's that right there? So a little bit up towards the hip?
Yeah.
Okay. And a little more medial? No, a little more lateral.
Yeah.
But still that leaning up towards the hip?
Yes.
There we go. Now, is there any referred pain down into your knee? No, okay. Everybody's response can be wildly, wildly different here.
But I also, the last time you feel it refer down into a little bit.
Okay.
So like as it's working
Mm-hmm. So usually what I'll say is, like, when you first get onto it, it can feel phantom. It's like this light thing. When you find what I actually consider, I'll use the word trigger point just for colloquial discussion, but if you really feel it, it's like that's it. That's it. There is no like, oh, maybe that's it. No, like they'll go, oh my God, that's the spot I'm having problems with. Like you're having a problem with your knee and I press up here and you're like, oh my God, that's it.
Mm-hmm.
Yeah, that's the real like referred pain that we're looking for. So you'll notice that my leg is kind of like in pigeon pose. I'm just turned to the side here just to make this really, really comfortable. If this doesn't quite work for you, feel free to change it. Maybe you can't do it on the left side. Maybe you have to switch to the right. Some of the positioning can be a little bit different. Just make sure that one, you feel comfortable, and two, however you are delivering pressure feels good to the client. So coming right back, rocking higher or lower? Lower. And I'm going to move the towel just a little bit because she's getting me down towards the knee. More or back up?
back up.
Tell me when.
Right there.
Right there. Still lateral. Because when I grab, her leg is rolling in. So right there.
Yeah.
And then up towards the hip.
Yes.
Now, more lateral or more
Yes.
medial?
More.
More lateral right there.
Yes.
And then, whoop, we slid again.
No. Like all of that. Yep, there.
Still up.
Yep, right there.
There we go. Now I pulled my leg, you can barely see this on camera, I pulled my leg far back just to give me some support to be able to stack body weight. When I was using my forearm on steroids, The therapists often are going to have enough control over that to be able to do it, but I've just done it so many times it doesn't matter. My legs are like my hands at this point. You want to be able to use multiple different tools depending on the client you're working on, depending on the pressure they want, depending on the specificity. You know, a broader range of tools is really what I'm trying to help the therapist with. And again, a little more lateral.
Yeah.
And then still up. Oh, no referred pain? Okay. And my guess is we're catching the quads, but we're also catching vastus lateralis. Mm-hmm. That's what I think. That's why I think it's why for you it's a little more lateral. Yeah, a little more lateral. So I'm going to slowly back off here. And I think I'm going to go to the opposite side as I'm checking our time here. I'm completely blind. I don't know if you know that. I have to have reading glasses now. Yes, I'm that old. I remember teasing my father as a kid. I'm like, Dad, why can't you read that?
Karma. Don't
why can't, Dad, what's wrong with Dad? You can't read that? And I was like, oh, well, then it hit me. I was like, I thought I was good. I could read the menu in low light. There we go. So as I'm switching sides here, I want to see if we can capture this. As I'm switching sides, I'm just trying to make my hip comfortable. I even had like a little click. My hip shifted, like its position, but it feels totally comfortable now. I'm going to double this guy up. And she was having more issues down towards the knee. I want to see if it's generally the same on this side. Still feel it. Yeah. Is it still more lateral?
Yes.
Yeah, okay. And I'm just slightly changing my position. You can see that she's just draped really comfortably over my knee. Right there?
Yep.
There we go. Now, the great thing is, to me, it's just repositioning the client. One of the reasons I like the mat so much is in 3 dimensions, literally, I can choose anything to work on, move you around to use the tool that's the easiest way to access it. They think it's prone, supine, sideline, seated. No, it's 3-dimensional, like get it done. Change positions constantly, by the way. Sometimes you'll just relax in one position for a while, but this is the only time this session in 2 hours that we put you on your back, like supine. Yeah. Still right there. And then what is that? A little more lateral?
Yep.
Right there. Yes. Do you like when I strain for you?
Yeah, I do. I like when you took the word right out of my mouth.
So hooking in right there. So guys, we got about 5 minutes left. If you have questions before we go, feel free to text or call. Again, there are links down below. If any of you were participating for free tonight because of the 2 free hours, one, I'm going to come back to this video later. I don't know when. I'll try to get to it in the next couple days. We're going to set up a quiz online so you can get credit from the National Certification Board, NCBTMB, 2 free CEs. If you want to purchase the rest of the class, there are 3 different links down below this video that will allow you to do that. In a 6-hour format, in a 12-hour format, and a 12-hour format with the workbook and DVD, which I don't have in my hand to be able to show you. But a lot of people I found were choosing that option. If you want any of those, just order those. We're going to have the next class, I think next week, same day, Monday, 5 to 7 p.m. Chris is going to be here again. I think we'll probably, is that what you want to focus on? More like legs and knees and stuff? Okay. Yeah. No, it's fine. So the thing is, I wanted to do this first one kind of general, you know, some basic stuff I thought would help people. But we're going to go into more depth and more specificity from class to class. And being able to have a specific topic helps me iron out like what anatomy to pull up so we can use that. Yeah.
Get that guy's feet.
How's that right there? Not too much?
No.
And I've reinforced with that left hand. This feels really good to me to be able to grab right here. And again, just before we finish, I want to go ahead and talk about, we got into the traps, especially the upper trap with some mobilization and compression. We got into levator scapula with the same. What we were really doing is opening up the pec and pec minor by opening the chest, though we still put some pressure in the trapezius and the rhomboids to be able to make people feel like we're listening to them and where they, have problems. Then we spent a little bit more time going into gluteus medius, which was the deeper muscle, and the gluteus maximus. That's a good brief overview of what we've done for this class. And again, each class we're going to go into a little more specificity, a little bit more depth. The links are down below if you want to grab that. If you have questions for me, please just contact me, even after the class if you don't want to do it live. I'm going to take some pressure off for a second here. I'm going to put that down, slide my shoe back on. And Chris, you can go ahead and, I want you to stand up in a minute. Take your time. I just want you to stand up and move around. Tell me how you feel. So you said the problems with the knees, right?
Yes,
Is it like when you,
squat.
yeah. So it feels better now.
I can still feel it a little bit here.
A little
but
bit?
We worked on this side twice.
Yeah.
So I expect this one to be a little bit better.
Okay.
But yeah, I mean.
So even without weight, you still feel a difference when you squat down.
Yeah.
Yeah.
Yeah. Like, I mean, I can feel it. Like, my knees are already like, don't even try it.
Yeah.
So.
Yeah. Okay. So we'll go ahead and probably continue working on that next class. Again, guys, if you need anything from me, feel free to reach out to me. The links are down below. I really appreciate your patience. We got started just a few minutes late because I don't know, I couldn't connect to YouTube for some reason. It was being weird. But hopefully everything went through well. The stream looks like it did great on my end. I really appreciate you coming in and joining us. I want you to study with me interactively as part of our CE party. We're going to continue to do these week to week. After this class, after table tie massage, we're probably going to do the intro tie version, the mat-based class, the first original class. We're probably going to do that over the course of 3 months, going through that meticulously, picking it apart. We'll have stuff for that available later. Again, if you have any questions for me, let me know. But I really appreciate your time. And do you want to tell them where they can follow you or whatever?
Yeah, so he's got some of my links, but you can follow me at Starfire Inc. I'm on Instagram, I'm on TikTok, oh, and I'm on Twitter. Try to think of what else there was.
Cool.
So yeah, come follow me, my friend.
So again, thank you guys. I really, really appreciate it. And I'll see you guys again soon.